Assalamu alaikum students. I hope you all are in good health and safe at home from the coronavirus. Today we are going to discuss about some infectious equine diseases. And first of all, equine infectious anemia. This disease causes anemia in the horses, and it is caused by lentivirus, which belongs to the retroviridae family. This disease is characterized by fever, anorexia, anemia, and jaundice. Since 1900, there is no treatment and no vaccine is was available because the virus is intracellular. This is just AIDS of equines, as virus is related to HIV and cannot be recognized by immune system. This virus stays in the tissue, macrophages, and monocytes. It is being spread through the vector, and vector is biting flies, particularly horsefly. Other blood-sucking vectors also play important role in its transmission, like mosquito and hematophagous flies, which suck blood from the animal. These flies suck about 10 nanoliters of blood during a single bite, and after 30 minutes to 4 hours, they have to again engorge their body with the blood. So, if after this time they again bite an infected animal, and from there it can transmit to the healthy animal. Flies can travel to 4 miles, so in a circle of 4 miles there are chances of spread of infection. Season is also very important, so in early spring and start of the rainy season, huge number of insects, as it is the breeding season of the flies, so more chances of the spread of disease. Coming toward the pathophysiology of this disease, after entering in the blood, virus goes to liver, kidney, spleen, lungs, and cardiovascular system. It also stays in blood vessels. This virus can also stimulate B lymphocytes and T lymphocytes, so both humoral and cell mediated immunity is present. In cells, particularly when it is present in RBCs, when antibodies attached to virus present in the RBCs, they also destroy the RBC, due to which anemia occurs, and there will be signs of jaundice. There will be pale mucous membrane. Once animal becomes infected, it remains the carrier throughout its life. So whenever there will be stress, malfunction, or the change in the climate, infection may develop in the carrier animal, and recurrence of this disease is very common in feature. Coming to the clinical findings, the disease occur in three forms: acute form, recurrent form, and the chronic form. The, the two main form are acute form and the chronic form. In acute form, you will see the high rise in the body temperature when number of viruses increase thousands or 100,000 times in the body from original level. In this disease, there will be high fever, thrombocytopenia, severe anemia, and jaundice, and due to which the pale mucous membrane will be seen, and progressive weight loss in later stages. And other related signs after 21 to 64 days post infection, that are like infertility and abortion and colic may be seen. In case of the chronic form, there will be recurrent fever, progressive weight loss, and severe anemia, and you may see ventral abdominal edema, and there is loss of protein, and fever depends totally on the type of the virulent which is causing this disease. Coming toward the diagnosis of equine infectious anemia, it is based on the clinical and lab findings. There will be low level of hemoglobin, RBCs, and thrombocytes. Specific test is agar gel immune diffusion test, and antibodies persist after recovery for 45 days, but virus could be present throughout the life. And passive immunity acquired from the dam and remains for 6 months. Naturally immune horses can be recovered but remain carrier for whole life. So you have to remove the carrier animals from the area. And the treatment, there is no specific treatment. As a sportive therapy, we can give liver tonic, fluid therapy, and hemopoietic agents, which increase the blood production. And in prevention, we can control mainly the vector, and in the vector, then we have ticks also. So for that, we can use dipping of the animals with Negovan or cypermethrin or Ecofleas, and it is being used as 1 liter in 100 liter of water. Coming towards the management, there should be no cracks and crevices, and dung should be removed regularly, burning of the shed, and no filling of ponds. Change bedding regularly, control stress factor for the animals, and this problem is more in USA than in Asia. Then the other disease we are going to discuss is equine influenza. Equine influenza is most common disease of young animals worldwide, and it is caused by equine influenza type A virus. And the subtypes of these are H7N7 causes a equine 1 infection, which is mild in nature, and H3N8 causes equine 2 infection, which is severe in nature. So the type 1 infection, it is mild form, and influenza stands flowing out of the nose. There are respiratory signs, hyperemia, and edema, sloughing of the mucous membrane, particularly of the nasal passage, that provides opportunity for the secondary infection by fungus and bacteria. For example, strangles caused by Streptococcus equi. Coming towards the type 2 infection, it is severe in form, and there is bronchopneumonia, coughing, and dyspnea. Lower respiratory tract is involved, lungs are involved, and the virus causes pneumonia, which chokes the lung alveoli due to accumulation of exudate that causes encounter of defense cells and virus. As a result, pus is formed and accumulate in alveoli, due to which there will be dyspnea and cough, and with the cough there will be exudate. And virus can also affect the myocardium. It can also affect the brain and may cause encephalitis. In the clinical finding of equine influenza, we can find the cough, fever, sneezing, and serious nasal discharge, which becomes mucopurulent later. There will be muscular soreness due to the improper exchange of gases, and harsh, loud cough initially. With the time, intensity of the cough decreases. So for diagnosis, we isolate either the virus after the clinical findings, and we go for the CFT test. It can be used to identify, and the nasal swab should be taken within 48 to 74 hours post infection. After that, we cannot isolate it, and through the detection of antibodies by ELISA, we can diagnose this. And in the transmission, it is seen that it is very quick spread in the herd if it is once got by some animal. And the rapid outbreak can occur in a herd due to the inhalation and exhalation through the air. And the transmission of virus from infected animals through transportation also occurs. And some veterinarian also are the source of infection, as by treatment of infected animal they can transfer virus to the healthy animals. An animal becomes immune for 1 year if it is infected by this disease. Coming toward the treatment, and the best treatment is to provide rest to the animal for 1 week, and no race should be done through the animal, no transportation of the animal, otherwise it may linger on. And in case of secondary infection, we can give with the antibiotic procaine and benzyl for 2 times a day, and good hygiene and friendly environment for the success of the treatment. And we should give rest to the animal also. H7 and N7 and H7 and N8 vaccine with both strains should be given to the animals after first dose. Booster is given after 1 month later on, and then it is repeated annually. When 6 month or more age, give the first shot of the vaccine, and if in case the dam is not vaccinated, then foal could be vaccinated at the 1 month of the age, and provide 2 to 3 days rest after the vaccine. Otherwise virus can resemble and cause infection in the animal. There is too much shift and drift in the virus rapidly, due to which the vaccine can be failed. And then another disease which we are going to discuss today is African horse sickness. It is more prevalent in African territory, but can be prevalent in other countries due to the import of the animals. There is 95% mortality in this disease, and it can affect the horse, donkey, mule, and zebra. Colicoid mosquito involves as a vector to transmit this disease, and common in lowland and marshy areas. The virus belongs to the family Reoviridae, and there are 9 serotypes: low, mild, and highly virulent in nature. On basis of virulence factor, it can occur in various forms. So the per acute form, it is very dangerous and also known as pulmonary form. It affects the respiratory tract, and clinical signs include the spasmodic coughing, exudate from the nostrils, and death may occur due to the asphyxia or respiratory arrest. Pneumonia blocks the exchange of the gases due to the excessive exudate, and it may lead to the hypoxia, and there may be damage to the brain. And this is caused by highly virulent serotype. There is 95% of mortality in case of peracute form. Then subacute form, this form is known as cardiac form. It affects pericardium of the heart and may lead to congestive heart failure. There will be edema of the lungs, head, neck, trunk, and limbs, and mortality is 50%. It is low virulent type of disease. And acute form, there is a combination of clinical finding of subacute and peracute form, and mortality in this case is about 80%, and that occurs within 3 to 6 days after onset of the clinical finding. Then at last we have a mild form, a virulent form. Then the clinical picture in this is mild in nature, and fever along with subsequent signs as high fever, anorexia, loss of condition, depression, and mucous membrane becomes red when the animal is suffering from the fever. And this is more seen in zebra and donkey. Then we have necropsy findings. There is edema of the lungs, left congestive heart failure, hydrothorax, and fluid in the pericardium. For diagnosis of this, we go for the isolation of virus in direct test, and detecting of the antibodies by HAT, CFT, and ELISA. And for prevention of this disease, we can do the polyvalent vaccine containing all the 9 serotypes in African territory. And for control of this disease, mosquitoes must be controlled by spraying on the ponds. The vegetation should be removed, and eradication of the ponds of stagnant water. And there is high incidence of disease in hot weather, so it must be controlled. So this was all, and if you have any question, you can ask me in the group or in the comment. Thank you so much. Allah Hafiz.